Alert your doctor if you have a history of keloid scar formation. If you have been treated with Accutane, it is unsafe to have a procedure such as these performed until you have been completely off this drug for 1 to 1.5 years. Phenol peels are unique in that rapid absorption of the phenol in the body can cause irregular heartbeats, which could be very dangerous. Because of this well-known phenomenon, experienced physicians have learned to apply this chemical very carefully and slowly. Be sure to let your physician know about any medical history relating to your heart if this type of peel is contemplated. Dermabrasion, chemical peels, and laser resurfacing of facial areas can be done in less than an hour most of the time. These procedures are commonly done without a general anesthesia. Often, the patient is simply sedated, or a series of small injections of numbing medication can be administered. Of course, a general anesthesia is also often chosen. You should discuss these preferences with your physician. Post-operative instructions vary greatly among physicians. The important thing is that you follow your physician's instructions very carefully to give yourself the best chance for an optimal result. Most physicians will want you to keep the treated areas covered with an ointment or dressing of some kind for the first 5 to 10 days. During that time, your face will be swollen, red, and weeping, and you will definitely not want anyone to see you. Often, your physician will also place you back on medications such as skin bleachers and superficial exfoliants after your procedure to help speed up your recovery and even out your skin tones. It is also common to repeat these procedures again after adequate healing time to provide a possible chance for more improvement of your particular problems. Here is an example of a patient during the healing process after a deep phenol peel. In the top left corner marked by the arrow is the pre-treatment photo. You can see many wrinkles and lines on the cheeks and around the mouth. The next photo below was taken 6 days after the peel. A crust or scab will likely develop over these treated areas and be replaced by new, shiny red skin in about 7 to 10 days. This is a time period where you will not look presentable, as you can see, and pretty much have to stay home. It is also important during this time not to scratch the surface of your skin. You should consider your skin almost like wet cement, and any trauma can lead to permanent scarring. Usually after 10 to 14 days, makeup can be applied and you can get back to a more normal life. The photo in the bottom left corner was taken 2 weeks after the peel and shows continued redness and swelling, although concealable with makeup. It is common for these areas to sting, but oral pain medication is usually effective in treating the discomfort. Itching is also common during this period and can be treated with ice packs, antihistamines, or with ointment. Your physician will be able to help you through these problems. You can see how the general redness and swelling subsides over the next few months by these photographs during the healing period. The picture on the bottom right, marked by the arrow, was taken approximately 2 months after the peel. This after photo shows a remarkable improvement in the wrinkles on the cheeks and around the mouth when compared to the photo in the top left corner. There is a slight change in color of the skin. The degree of inflammation, redness, and swelling discussed and shown here again depends on several things, from how aggressive your treatment was to how sensitive your particular skin is. If your problems were very mild, your treatment probably was designed accordingly and your recovery period will be more rapid. To decrease the likelihood of permanent changes in color or pigmentation problems, you should avoid exposure to sunlight for 3 to 6 months. Effective sunscreen should also be used every day. You should also follow the orders of your physician regarding medications and skincare products before and after the procedure. This is a before and after photo of a patient who had a deep phenol peel around the eye area. You can see a tremendous improvement in the wrinkles around the eyes. A special thanks to Robert Kotler, MD, FACS of Beverly Hills, California, and author of the textbook Chemical Rejuvenation of the Face. He provided the pictures of the patients who had the phenol peel in this segment. This is a photograph of the area around the mouth before a conservative dermabrasion and laser resurfacing. The treatment was intentionally very conservative, since she previously had a chemical peel and laser resurfacing performed in this area in the past. To have an idea of one's appearance during healing, the photo on the bottom was taken 3 days after the treatment. Again, she had dermabrasion of just the upper and lower lip border and laser resurfacing of the remaining area around the upper and lower lips. The photo on the top was taken 5 days after the treatment, and on the bottom 10 days after the treatment. Usually by 10 days, makeup can be applied to cover up the redness. She does not have makeup on in these photos. This is her pre-op photo on the top and a photograph taken 3 weeks after the treatment around her mouth on the bottom. A definite improvement can be seen. However, a more aggressive treatment would probably offer more dramatic changes, but with an increased risk of potential complications. Botox and collagen should be administered in a healthcare setting by qualified and trained healthcare professionals such as a doctor or nurse. A detailed understanding of the anatomy is important to decrease the risk of possible complications. If complications were to occur, these would also need to be addressed in a healthcare environment. This is even more important when considering dermabrasion, aggressive chemical peels, and laser resurfacing.